Everyone in our body is grouped 5 different tissues that can cause issues and pain for people, especially when there's been an injury. These these 5 types of tissue are called tissue differential testing, and they are inert tissue. First of all, inert tissue is ligament, fascia, and bursa. Bursa's caused a lot of problem with people, especially in the shoulder and the hip. Hard tissue, so there's bone, there was stress fractures themselves. Contractile tissue, that's tendon and muscle in particular. Fascia does have a small contractile component, and I see that more and more in my work. Whereas a muscle will tighten, then let go at a certain point, fascia, it'll tighten and won't let go. And it can actually stay locked on for months or even years. And it requires a certain kind of skill set to open that up. We're looking at nerve, the conductive tissue through the body. Nerve is quite easy to see if there's a problem. There's a certain pathway. There's where people will point to the whole arm. It's sort of sore all around here. It goes down here, and then it's sore here, and then it's sore up here later, and that kind of thing. So it's pretty easy to see. And there's some pretty effective techniques you can do to help with nerve problems. And fluid. So fluid do with blood, lymph, and interstitial fluid. That's pretty easy to see, and do some testing and that kind of thing to see if that's the cause of people's pain. We're looking at blood clots, abscesses in certain parts of the body, poor lymph drainage, swelling in joints, that kind of thing, and swelling in the feet, a pitting edema where you push into the swelling in the feet and it stays indented. That's pitting edema. It's reflective of left-sided heart failure. I think it's left-sided, might be right-sided heart failure. So there's lung involvement there too. So when in the clinical setting, when someone comes in to see me, doing certain kinds of tests to test these different types of tissue to see which ones are showing up as the potential ones that are causing the most problem. It gives an idea of prognosis of how long that's going to take to get better, and the direction where the treatment will go to affect those tissues the most and get the most effective treatment. When people come in, I also tell them, I ask them about their history. I get a subjective history, so how they did the injury. I marry that up with the findings that I found in the objective exam, where I'm testing different parts of the tissue, testing muscles, that kind of thing. The nature of the pain, where it's sore, all that sort of stuff. And 80% of a diagnosis or an idea, an indication of what tissues is damaged, it comes from that subjective history, that first lot of questioning, and then the rest of the time then is just confirming, is that what it is? Is that a pattern that I'm seeing, or is there something a bit different going on? So that's what anyone trained with my kind of training, soft tissue therapy, physiotherapy, osteopathy, chiropractic, they'll have very similar tests, and they'll have some extra ones and things. Within my skill sets, what's extra also is body reading and a structural diagnosis of where particular muscles are under tensile load, they're too tight or too short in different spots, and how that can be affecting the side of the pain. Because when it comes to pain, usually the area that's painful is not the actual site that's causing the pain. It's just like in law enforcement, the victim is the one that's screaming out and crying out, and all the attention is given to that person. But the perpetrator is somewhere else. We have to find where the perpetrator is. And that way the treatment lasts longer, and we actually get into the crux of where the problem is. And that's a big thing that I do in my training that I've been trained in. I hope that helps. So, yeah.